Jonny Jackson and Bjorn, thank you for being here. Bjorn, founder of BiteFinder. Jonny, you're at Evolve and you've been using BiteFinder. And here we're going to start by looking at a case that the bite is overclosed for sure. And we need to open it. Prior to BiteFinder, what would you have done when you received a scan like this? And then with BiteFinder, how are you solving this type of big issue where you get an overclosed bite that you got to open?
So if I typically got a case like this, I would be sort of screwed. I would call them up firstly, and I'd say, "Hey, are all the teeth out yet?" If they are, then I'm even more screwed. But if not, then I would ask them for a new record for obviously in an open position because getting a scan like this is obviously not where I want to be initially when starting a full mouth rehab. Um, they're obviously overclosed. They've got a lot of wear there. The function's very poor, and there's a lot of things that we need to do to get them to the right spot in this case. So that's where I would initially have started with something like this without knowing about Byfinder.
So it would have been a no-go prior to BiteFinder. So then now with BiteFinder, it's going to use its AI, I'll call it voodoo magic, to open the bite. Show us the open bite and then talk us through like how accurate is this, and earmuffs, Bjorn. Johnny's going to give his honest assessment here.
Yeah, so I've been using this for about 3 years now, and here's the open bite position. I opened it about 5 or 6 millimeters, and it generated this. It took the wear on the teeth when I brought it through the software, and it first starts in the MIP position, or you can keep the bite scanned in. So you have a couple options when running it through its analyzation. Is hey, I want to keep this bite as scanned, or hey, I want to correct this bite and get a better MIP position based off of the wear. So after it runs through its analyzation, it'll give you a report on its contact quality, whether you're increasing the contact quality or the percent of how much better it is than before. Um, After that, you have expert features, and you're able to open the VDO from there. Now that's huge, right? It's not only finding a bite, you're also opening accurately. And I've used this so much. I've been using it every day for the past 3 years, ever since I've known about it. And it's saved me so many times, whether if I'm in a bad situation or a good situation. It gives me an enhancement on the case because of the wear on the teeth.
This
So,
is incredible. I
yeah.
Bjorn, without giving away any secret sauce or algorithm type stuff, like what is BiteFinder doing here to open a bite into a new opened position that's accurate? I can't wrap my mind around this because prior to BiteFinder, I can easily understand how there's no way we can proceed with this case, right? Like it's a rescan the patient, and if the teeth are out, we're all effed. But what is BiteFinder doing here to open it into a position that's close to where it needs to be?
So the good thing is we've been training this for many years now on great data, right? So the foundation is we we had a nice saying at IDS this year is we taught the computer to see what our hands or the patient's teeth feel, right? So we get into that MIP position, right? And to be honest, at this stage, it only works if you have some dentition left, else we're also screwed for now. Uh, give us time until the next update. But then what it does is it kind of analyzes the history of the patient, right? So it looks at the wear and tear over time. It looks at remaining teeth. And based on that, it reverse engineers the kind of movement that the patient could do in this position and has done over the last years. And based on that and lots of data input, we can predict the most likely opening of the jaw. And this is, of course, possible to a certain degree, right? The more you open it, the less accurate it gets, because we're
For
still
sure. Okay,
lacking.
thank you.
In most cases, we're still lacking the TMJ position, right?
Yes.
In the new version that we're going to launch, you're able to add additional data, right? And that will be a big game changer, because Jonny, for these complex cases, usually he gets a CBCT. And then you
can get condyle information.
Exactly. And then we can not only simulate from the anatomy of the tooth here, but also simulate what happens down here. For most cases, it's not super critical what happens down here, right? It's critical what happens here.
Yeah.
What happens at night when you do clench, when you're stressed, when you're, grinding the hell out of it, right?
Super cool.
That's where it's important. But yeah.
So thank you for admitting, because my mind was going there. Like, the more we're opening up this bite, the less accurate we're going to be, right? So opening it up, half a millimeter or a millimeter is less risky than like 5 millimeters, right? So I assume the AI can only go so far.
Of course. And then if we, you call it voodoo magic. It's kind of voodoo magic, but it's like an IO scanner, right? If you're doing bad impressions, analog, the magic stick won't help you, right? It's you have to take care and you have to realize where the limits are, right? But in general, we say we're good up to 3 millimeters. We see lots of users like Jonny who know what they're doing. They go up to 5, 6, 7 millimeters without any issues. And one of the most important things we usually talk about with our close group of experts is, of course, everybody wants to aim for perfection. But what is so important for us is compare it to the brutal reality that we have now, what is the alternative? I mean, just try to do it by hand and move it in space, or print the models and somebody in the lab is trying to put it somewhere. It's definitely better than that, right? Is it perfect? Not always.
You took something that's impossible and you made it possible. Right. And that possible is not going to be maybe like 100% perfect, but it's going to be close enough to get. So Jonny, you designed a case and proceeded with the case that prior to BiteFinder, you would have had to reject or demand, a patient bite. And we should call out here the obvious, that we should not use BiteFinder to cover us for sloppy dentistry or bad dentistry, right? Like, it can bail us out. It can help us solve small problems. But we shouldn't watch this and be like, oh, I don't need to send Jonny bites anymore because he's got BiteFinder.
Please send me bites.
We're getting there. But the principle stands: garbage in, garbage out, right? So we have to focus on overall general data quality, right? Capture the arch. Please don't do only quadrats, right? That's super important. Get as much information as you can to do like the most comprehensive dentistry, right?
Hold on, I'm gonna scan a quadrant upper left and a quadrant lower right, each with a crown on it. Can you articulate that for me?
Yes, stitch them all.
No problem. No, but that's the right point. It's use the brain.
I know.
Yeah,
for sure.
Sometimes hard.
All right, Jonny, keep walking us through this case and how you manage the open bite and how you use the tools in BiteFinder to get to an acceptable result, which still seems like voodoo magic.
Yeah, it pretty much is voodoo magic ever since I've known about it. But with some severe cases, you're able to get away and get lucky. This is something that if I ran it through the articulator regularly without face bow mounting it, we would be hitting in the posterior or something. So I opened it up with BiteFinder, then brought that position into Exocad. We were able to wax some teeth into there for a full mouth rehab, and then turn it into a same day all-on-X. So the possibilities are pretty much limitless with this, and with the integration of Exocad. Yeah, it is a prototype.
Okay, good. How good was the prototype?
Dude, I mean, the midline was spot on. So this is that patient right there. And I mean, you print out this prototype and the midline's spot on, and you say you get a tax 0 adjustments. After something that severe, you almost get the chills, right? You're like, wow, that worked. That's insane.
I would stand here with disbelief. Right?
I know. They were so psyched they gave me a photo because I had a feeling they knew that they were in the wrong for not opening it a little bit.
Wow. This is amazing. Yeah, and you called out here what normally would be impossible was possible with Bytefinder. I think this is a great place to start. So maybe we'll back up and just talk us through how often do you use Bytefinder? What are the common problems you look for it to help you solve? Like, do you use Bytefinder on every case? Let me start there and then talk us through your use.
I do try to because I believe it has value in doing that. We do also have a nice lab bundle, so it allows me to. But I do try to because there's value behind it. Even just running it through, there's different ways you can use Bytefinder. Either you have the byte get corrected with this global static occlusion option, or you click this keep static occlusion. So you can keep bytes as scanned if you do believe that's an accurate byte. So, you don't want it in MIP sometimes. So you might need it in CR. So you can keep it in CR and still run the motion. So these are things that are possible with this software. And we do have a bunch of other options in here, but I don't use all of these options because all I need is this transform to original selected. So the data orientation stays the same as what I imported. There's XSnap 360 models. You're able to batch manufacture a bunch of models at once. If anyone's seen those XSnap models, they have the
They're beautiful.
hinge attached to it, and it also takes the wear from the byte finder and the motion, and it applies it to the XSnap model. So those are really awesome models that will auto generate just from this cool software here.
And that XNAP is the one that's got the patient specific guide pin, which is incredible. I'm gonna 3D print a model, click it together, and it's now a fully articulated, patient specific guided full arch model.
Exactly.
It's insane. I love that.
And it does it automatically. And you just throw the scans in there, and it gives you the XNAP model afterwards with that patient-specific motion with the little pin in the middle of the mouth.
Let me maybe jump in and add something on the do
Yeah.
you use it on every case, because that's super critical. So now as we've been processing millions of cases, right? We get data sets from labs that are into, hey, it's interesting what you guys are doing. Like, how's my data looking like? So they send us a bunch of whatever, 10,000 cases, right? We analyze them, and we usually get to something between 80 and 90% of the scans they get are wrong. And not
Wow.
only a little wrong, right? Like, you shouldn't really work on this wrong. And then you have
Well,
the
let's
remaining.
talk about this. Even if it's a little wrong, a half a millimeter or a millimeter, right?
Yeah.
That's a mile in the mouth. And now the doctor is going to have a really heavy occlusal adjustment, even if we're doing a single crown. And that's nobody's fault but the data that came in.
Yes. Yes. So that's super critical. And besides the lab giving its best, right? People have sweaty, bloody hands because they are fixing everything before it goes out, right? We like shout out to all the people in the lab who trying their best to QC stuff. It's impossible to get it right if you need to work on that shitty data. And if you rely on old school technology, on average value articulators, because that is not the human that is sitting in the dentist's chair. And you mentioned it, the biggest impact we have is if we can save the doctor 10 minutes on every treatment, that's big, right?
Huge. It's huge. Makes everybody look good and feel good.
That is, and something like Andy from Evolve, like we discussed a few months ago, was quite interesting, where we said the problem is for too many people, good enough is good enough, right?
Yeah.
And we
That's a
said
sad statement.
not good enough, right? It's not. It goes into a patient's mouth, right? We should care
Yeah.
more. We shouldn't
Yeah.
say, oh yeah, we just do it 1 millimeter non-occlusion, so there's no early contact, so the doctor doesn't have to grind, right? That's not how we should.
Yeah.
Right.
Yeah, all of our teeth are super erupting into occlusion, right?
Right. Good idea.
Yeah. No.
But the problem with using it, so in theory, you should use it on every case, right? And we are developing more and more into a QC tool that just looks at every case and gives you a score and only optimizes and we charge only by giving you a better result, right? By actually improving the data. The problem there is most people run on old school lab management systems, closed systems where we cannot access the data, where it's too much of a manual work to grab the file, export it, go to Bytefinder, use it, export it, re-import it. That's a horrible workflow, right? So Evolve also just onboarded a new lab management software where there's the option to run it on every single case finally, right? But for
Hold
that,
on.
of the technology.
Hold on. So you receive a case into your LMS, lab management software, and you're running Bytefinder before a designer even opens the case for the first time.
Yes.
Correct.
That's also insane. That's amazing, right? So your workflow efficiency. And then, Johnny, you're not telling people, well, did you use Bytefinder on that case? Right? They're just, they're receiving it as already processed through Bytefinder.
It's not even a choice, but I mean, they do have that folder in there of the Bytefinder process data, so they can compare. But we do believe that their knowledge in the software and dentistry that they can analyze and see if it's better or if they want to use it or if there's function that you don't want to use, right?
So here, this
Um,
case that Johnny has open, it's the opposite of what we saw before, right? So you have the closed bites, and you have the slightly open bites, you have the tilted bites, you have the shitty bites, you have the full package, right? But it's never one thing. It's never consistent.
Never.
You always get something different.
Well, Johnny, let's walk through like how you use Bytefinder on this case and just tell us what you're doing while you're doing it.
Yeah. So I received these scans. This is just a typical, looks almost like a traditional converted denture, right? And obviously this side's open. I mean, it's almost a given with that wear right here. And I mean, they probably had them numbed up, if I'm being honest. Look at the bone screws in the palate. What kind of bite are you going to get with a numbed up patient with bone screws? Not a good one. So
Yep.
that's what we received, right? So we were able to use the Exocad integration, click Bytefinder, and now that you clicked Bytefinder, it launches the application, and the scans are automatically in there because they were labeled upper and lower. It finds the upper and lower, and then what I did is I marked the occlusal areas where I felt that there was contact. So if you hover over it, you can tell it increased contact likelihood. You can also tell the
So you're giving it
software,
some guidance.
yeah, some guidance because you do have some knowledge and it is a computer, right? So give it a little bit of guidance. I typically always use the increased contact likelihood, and basically I'll paint the areas of where I notice it needs contact quality, right? I do believe there's some wear right here as well, on the incisal edges. But now that that's marked, it went through the motion, and I got a report. I'll show you the report after I save it. But now it creates the motion off of the wear facets. So it gave me a really accurate motion based off of the wear. And you can see it closed up that contact that was before severely opened. I mean, the patient was numb. I don't even expect the patient to bite properly numb. You know what I'm saying?
Yeah, and this is not a very easy bite to manage. A lot of
No.
worn flat areas. It's more of an end-to-end bite. Like this is a difficult one.
It is difficult too, and I'm actually very surprised that it's high quality of how it generated, right? I mean, I'm very happy with something like this. I can see that it all lines up where it needed to be.
And then show
Just
us the
by
report you look at to sanity
yeah.
check the bite.
So we can open the VDO with this slider here, and you can open it based off of how much you see fit the patient needs. So let's just open it at 1.5, and it'll still do that motion from the 1.5 open position. And then when we click save, you have a couple options. It's like transform to original. That's what we want. It'll export in the position that you gave the STL data. And then you can choose the format. So if you had a color file, I didn't get a color file. You can change it and export it as OBJ or POY. So when we hit save, it'll go right to your Exocad database folder. So if we click Open and Explore in Exocad, you'll see the files from BiteFinder are automatically in here. So we have the
Thank you, Bjorn. That's a good feature.
automatic, like so awesome. And it also put the jaw motion, Exocad jaw motion file in there. But here's the report. So as it loads up, let's see. Refresh. There we go. So we had 3 contact points when I initially got this data, which is not that great. And that's initial point of contact too. So now after the simulation and running it through BiteFinder, we have 11 contact points with 100% contact quality, which I feel a lot more confident about this. And you can even see on the occlusal, the blue on all the wear facets. And here we literally have none. So there would have been some occlusal adjustments with a record like this. But now I have much more confidence going through the case with a higher likelihood of contact points in the wear facets that are obviously visible. Like, because we all equilibrate stone models, right? And
Yep.
I believe it's very similar to doing something like that. If you have the wear facet, you'll equilibrate it with that stone model of the
Yeah, I
wear,
mean,
right?
the old school technician heroes that we know, I mean, they're really good at putting this jigsaw puzzle together,
Right.
and you can find a bite, and I've seen technicians do that, but doing that at scale and speed and accuracy, and then mounting it in a way that if you open it at the pin, are we even close to this specific patient? So I mean, I appreciate the old school skill, but I can see how this is so much better.
Yeah, I've been blown away by this software ever since I've been introduced to it because I did get a lot of background in learning about occlusion and contact points initially with other kind of processes, but then adding this to the play, all just like everything locks together. Like, wow, this all is perfect and it makes sense.
Do you use this report as like a feedback tool to your doctors of like, hey, your bites are normally way off or really off most of the time? Because if I'm a doctor and I actually want to do really good dentistry, I would love this information. Like, all right, how do I scan better? Right? Like, how do I get my iOS scans better so that this occlusion report is better? Like, have you had any of those type of positive conversations with doctors?
Yeah, I have actually. I do provide this. I'm like, hey, this is actually the bite that you gave me. I know maybe on your scanning software it looks different, which I get that a lot. It looks different on the scanning software, right? Well, once we actually
Was good when I did
analyze,
it.
yeah,
Yeah.
once we actually analyze it, the content quality is very poor. So when I give it to them, they do then see the realization and the benefit of using this software and working with a lab that's actually doing something like this for their data. You know what I mean?
Let me. This is super critical, Rob, that
Yeah.
you mentioned this. So it's not the dentist's fault, right? There's 3 reasons minimum, but 3 main reasons why this fails and why you can't fix it. Number one, scanning software, right? You have a scanner, you you bought it because it's supposed to be faster than physical impressions, right? So you actually try to be fast. Then you have the approach of matching, right? So you scan upper, you scan lower jaw, then you scan the bite. So whatever you scan in that moment, this is the reference. So then you have matching errors from signal jaw to the bite scan. And it definitely relies on the scanned bite. If that's
Mm,
wrong, also the matching is wrong. Number
sure.
two, the person who is doing the scan, right? Busy, tired, not trained, whatever, right? And most importantly, like Johnny mentioned before, the patient. Tell the patient to
Yeah.
bite down. What do? Something,
Yeah.
right?
They
But
bite
not,
rum.
they have no idea. They might be scared of the dentist. They have anxiety. They might be tired. They might be numb. They slept on their right side, have an early morning appointment, and they just can't. They can't. They have pain. If you have pain on this side, you clench harder on this side. It's
Yeah.
impossible to scan and record a good bite.
Well, I know, iOS scanners are for sure better than triple trays. We can
Yes,
agree to that,
I agree.
right? But when we're seeking perfection or something that's really close to perfection, that many airwell scanners still struggle with achieving perfection on all the cases. So I agree with you. I can back up that Bjorn is not, BSing us and that, a lot of iOS scanners still struggle with perfect bites for those reasons.
Yeah. And you'll see after they analyze and go through the rendering of after you scan the bite, you'll see maybe a lower jaw just moves a little bit, and that's all it needs. I know I always rematch my bite scans in Exocad because I know scanning softwares, it'll initially just align it how it thinks it is. It's all automated, right? But really, where are your contact points? That's what I like to focus on.
So, Johnny, we won't name names. We don't want to get in trouble, but assuming you've seen a lot of iOS data coming in the pipeline. Are there certain iOS scanners that you would say they're just better or closer at getting perfect bites than others?
Yeah, I believe so. Some of them do, I notice the bite changes a lot more than others. I have a couple in mind that I see it happens to more frequently than others. And then I'm able to kind of think about that in my head when looking at data. Like, oh, yeah, okay, I see.
Bjorn,
And
I bet you know the answer to that, Bjorn. You probably have
Yeah.
a data mine of which iOS scanner is the best.
Mm. The best is tricky because there's too many other features a scanner has that might differentiate. But what I can tell is by really analyzing a lot of scans, we see patterns that you get different kind of errors with different kind of scanners. So
Mm,
one tends to have uh, more open bytes, and
okay.
another brand tends to have too much intersection. And there's
Oh,
one scanner that has the most completely fucked up bytes, like right, nothing. Um, and so there's different nuances to how, in which direction the type of error goes. But I wouldn't say it's per se. You don't have more or less problem um, depending on the scanner you choose. So it's not the scanner per se. So you couldn't say choose this one. It produces the best bytes. It's because they all have the same approach to a byte scan.
yeah. Well, I know, like I can speak to Three Shape Trios in a recent update. They now indicate for bite scanning on both sides of the arch. That makes total sense. More
Good first
data,
step.
better bite versus just typical
Yeah.
quadrant scan with quadrant bite. Okay, that's probably better than a triple tray, but why not do full arch scanning on all of your cases and take a buccal bite on both sides for all of your cases? And that's going to make a big improvement for sure.
Yeah. I mean, there's just too many different opinions on that, right? And I mean, there's lots of people now conducting studies on this, right? Comparing accuracy of quadrant scans to full arch scans and so on. And of course, we have our own opinion on that. Um, but in general, it's the more data you have available, unless it's only garbage data, the better, right? The more
I see that.
also the technician that receives the scan, like Jonny, the more he can use his brain, right? Because he cannot imagine data. But if he sees the data, he can try to make sense out of it.
Yeah. Amazing. Amazing. Johnny, any some other things you want to show us about Byfinder?
okay. Yeah, so you know how it exported into our folder automatically. We can go over the integration of what that has. So we have the new lower jaw in there. There's an old position and a new position. and then add the jaw motion into the case, right? So I believe this is our open lower jaw, right? So it's called markers. Markers is going to indicate that that was from Bite Finder, and we opened that about 1.5, right? And it closed the software. So when we go into design of Exocad, you can like almost immediately import that jaw motion XML data from Exocad. So you'll load up your upper jaw. So that'll be the surgery tissue matched. Then we have the antagonist, which is our marker lower, right? And so I'm going to set my scan orientation real quick, hit next and go to expert mode. So I'm going to add the pre-op in real quick, the marker upper jaw right here. And you can see that's already matched in open bite position. So everything's already automatically ready for me to begin the design and set some teeth. But the last step of it is this in the tools tab, you can go to jaw movement and we want to import in the reference position. Do you see how it searched the folder automatically for that? I didn't have to go and click it myself. So it automatically imported that jaw motion with the reference position, and I can tell it to do these motions. You can include all of them, you can include some of them in your motion. So this one I clicked all of the motions and I hit include selected paths, and it gave me the jaw motion with our cut views on that motion. So we can kind of tell if, they were functioning a little poorly. We're able to analyze that with our little sectional views here of the motion individually. So for instance, lateral left, if I go through this very slowly, you can see how they ride on their canine with the lateral left motion, right? So you can watch it with the sectional views. And when you're designing, you can add it if it's a good function, right? But if it's a function you don't want to include, then obviously do not cut that occlusion like that. But you're able to design while simultaneously with these motions in the open bite position.
This is a prosthodontist dream, right? It's patient. So this is all patient specific, guided movement. And
Right.
so, do you ever mount this in the full articulator in Exocad, or is that really not even necessary?
Not even necessary at this point, but if I saw a function that I needed to correct, I would change that function with the articulator, right? So if I needed to correct a lateral left, I would have to try and Facebook mount that with the CBCT or any of the other Facebook mounting techniques with like a face scan or whatnot, and then try and correct that excursive movement. But I really truly believe these motions are doable for this case. I don't see anything that looks like something that would be terrible to add for this prosthetic, right?
Yeah, so how often are you confident in relying on this data as this is all I need to get the best result possible?
I'm confident on it, almost about 80 to 90%. And then I have my bad cases with not a lot of records taken, or, you don't have any posterior stops. I can't really fix a bite or anything like that, but I can keep it in the scanned position, which is nice. So if I'm not confident on it, there's always an option to, keep it as is and still include some motion to your design.
Yeah, that's an important point, right? Where we started and where we currently focus on is reconstruction, right? Not rehabilitation. We still need somebody who realizes this is not normal, right? Patient just had an injury, can't function properly, right? This is a motion that he learned over the years, which is dangerous for himself. So we should not use that in the new
Mm,
design, right? We should give him
yeah.
new function, right? Completely rebuild the thing. For this, we don't have enough information, right? That's why our new version that we're going to launch now in the next few weeks will allow you to add more data, CBCT, face scan, pictures, everything that you would need to get the most comprehensive virtual patient to actually do great dentistry, right? And not rely on a gazillion different things and somebody who's actually talented enough to put all this together and
Yeah.
make something out of it. Right?
So Bjorn, I did a recording with Dr. Sven Bone, who takes full field of view CBCTs on 100% of his cases. I would love to get this software in his hands and have him start using it. Maybe we could do a recording with him, because he is all about, full CBCT scans, mounting it into Exocad, but he is visually approximating, lining up the center of the condyle into the Exocad articulator, which gives him good results that he likes. But my guess is you could probably take it a step further with your technology and save him some time in that hand mounting into the articulator.
Exactly. Yeah, that's the plan. And we do that with a few big DSOs, right? They focus on dentures, right? And there it's super critical, right? If you get an old denture, you can use the references, rebuild it. But most of them, and that's the beauty, have a CBCT with a big enough field of view, right? And that's currently the limitation. So even most people that do a CBCT, they do a small one, so we don't have the full view, right? And we need that to actually simulate how the joint would move also here, right? And then the last piece of the puzzle that's missing is soft tissue, right? So we're working on other cool projects where we can also include muscle measurements, MRI, the full picture.
What?
Really get the sweet stuff, right?
Ha!
This guy's
You're just
amazing.
gonna take all the work out of it for us.
It will give you the time to stop wasting your energy on bullshit, right? I think it gives us finally the time to focus on the patient and to treat more patients, right?
Bjorn, you just said something a few minutes ago too, that like if the patient has a messed up movement that's not optimal for them, yes, we should rehab and fix it, but that's going to take some time and attention. What's easy is to just give them up 2 full arches, match their existing bite, they're happy, but they could be in a motion that's just not good for them. We should look at that. I
Fully
love
agree.
this.
I mean, it's one of our slogans, right? No human is average, right? So don't use average value articulators. Do the best you can, right? Try to prevent bad dentistry, right? That is our biggest vision, right? Make sure that the lower 50% that is provided every day at the moment, that this is not happening, right? People get crowns that high and live with it the rest of their lives, and they don't have a clue why they have headaches, why they have whatever kind of problems. But also make good dentistry great, right? Help the people who do their best and get to 80%. Use the technology to give them 90, 95% and allow them to treat more patients, right? Because they take forever. They take 2 hours to place a crown because they want to do they want to kill the last early contact, but that doesn't allow them to treat more patients, right? And that's where we see ourselves helping.
Optimal patient outcomes for sure. We all want that. But something that I've learned or been awakened to is I never knew this stat. The average doctor hears the words from a patient twice a day on average. I don't want to be here, or I don't like coming to the dentist.
Yes.
Right. And so being a dentist is a really stressful position. Imagine, Bjorn, all of your customers telling you twice a day, I don't like working with you. Like, that would be hard. It's really emotionally draining. And so if you're using something like Bite Finder that is reducing the dentist stress in delivering patient prosthetics, what a huge benefit to the dentist emotional well-being, right? And to their stress reduction. And I think we sometimes forget that dentists, have a really stressful job. And if we can help reduce it, man, what a valuable partner we can be to them.
Of course. I know that. Grow up like that. My dad is a dentist. I know he spent his full day trying to fix shit. If you really care, if you want to be a good dentist, it is a horrible amount of time that you need. because there's too many variables and it's too complicated to hold everything together if you don't have the right technology in place. And you're always reliant on humans in the loop. And, humans are tired, and that's totally fine. Humans make mistakes, totally fine. But it should not affect another patient's life, right?
Yeah.
That is what
Yeah.
is so problematic in this case. And in the end, one of the objections we sometimes get is like, is it worth it to use it, right? It's another step in the process. It costs a little bit of money,
I'm
right?
good. I know how to do
No, I'm
this, right?
perfect.
It's a
What
nice to
money?
have, but not a need to have. You probably
But it's
hear
like,
that.
what is your time worth, right? Is it worth
So,
anything? That's the biggest question, right? And if you can save the time, then it's so valuable.
so Johnny, if we took Bite Finder away from you, how
Yeah,
worse would your life be?
I would be miserable, honestly. Please don't take it away. I would be miserable just because of how much that's out there that I see. Like Bjorn said about scanners, there's patterns that I see with these scanners. And obviously, some of them are way different than others on their patterns, but the pattern is obviously corrected very easily with the Byte Finder process, right? And then easily imported into CAD, which we use Exocad every day, nonstop all day. So this would be detrimental to our process.
Bjorn, that is the magical question that I'm I'm glad you used the word miserable, Johnny, because that's how you know you have loyalty, Bjorn, is if someone would be miserable without you, well, they're never gonna leave you. Right. And that is a and Johnny, you want your doctors. If I asked one of your doctors if you can't have Johnny anymore, you want them to give the same answer, right? I'd be miserable without Johnny.
Right.
Right? And that's what we're all trying to do in dentistry is to be such a valuable partner that they don't even think about working with somebody else.
Yeah. No,
Exactly.
fully agree. And I think the results speak for itself, right? We get great feedback also from the clinical side of the big DSOs that work with Evolve, for example. They see that on the cases. I mean, when a dentist calls you and like, what did you change? Why why don't I have to do so much anymore, right? Uh,
Yeah.
that's big, right? And that's rare. Usually you see less calls of dentists complaining, and that is good enough for most labs to see that it's
Let's
working.
let's talk about that. So Johnny, on average, how much were you calling your doctors and giving them some grief on their bites before Bite Finder? Either disclaiming the case like, doctor, if I make this work, remakes on you, or I can't do this case. So how often were you doing that before Bite Finder, and then how often are you doing it now?
So before Byte Finder, I was calling multiple times weekly, and I was saying, "Hey, there's going to be severe adjustments on this. I probably can tell you where it's going to be. It's going to be posterior, most likely, open anterior bite. Very typical with something with a severe wrong bite." Um, or, I'm going to print a model if I have that data to be able to do all that, and then wait and then scan the model in the hand articulated position and then apply that to the design. That's an extra like day on the whole process. So, I mean, it's severely impacted our workflow and the amount I have to bug these guys about their scans and everything, because you may have that repetitive customer that does have bad scans all the time. And I mean, how many times are you going to tell them it's bad before, I mean, if they're not learning, you can't just keep beating them down. Do you know what I mean? So
Yeah,
this is kind
that's
of,
where you decide, am I even going to continue working with this doctor or not? And there's a lot of other factors there.
I
But
know.
try to boil it down to a percentage of reduction. Like what after so now that you're using Byte Finder, the number of calls and grief you're giving to your doctors has been reduced by how much?
90% to 95%, if not none. I don't really have to call on it anymore. Not that, at least. You know what I mean?
And this is stress reduction in the lab, stress reduction for the doctor. How often does a case get delayed just because you can't get an answer from a doctor and you can't get the communication right and it gets stopped in production? Right? It's solving all of those problems.
Yeah, and I
Yeah.
think
It's
especially
amazing.
because Johnny specializes in same day, right?
Yeah.
So
So speed,
when
it's
you're at
huge.
same
Sometimes
day,
we don't even have the option, right, of just, saying no. There is a patient on the other end of that, and I feel for the patients more than I feel for the customer, really. So if the patient's got nothing and, I'm going to tell them no, go away, that's not really me as a character with that same day workflow, right? Like, I need to get this patient something that they'll go home, they'll smile, and they'll feel so happy about themselves without, really being stressed out about it, because otherwise I'd be sweating. You know what I mean? I got a poor record, I'd be sweating trying to get them a same day that is going to
Mm.
work. It wouldn't be possible in the timely fashion that you need to.
So Johnny's stress reduction is significant in your same day performance requirement.
Yeah.
yeah,
Yes.
and I love that, right? So for us, it's super important that we realize that it's also not only, I mean, aesthetics are crucial in our industry, right? It needs to be beautiful. Um, but why don't we make something that is as functional as beautiful?
Yeah.
What the hell is the benefit if you have beautiful white straight smile but you can't chew, right?
Or you
You
got
have
headaches, right?
headaches,
You got
all
TMJ
that,
issues.
and
Yeah.
so many people. I mean, we have even patients reaching out to us because they're looking on the web like, why do I have problems? Well, I have chronic
Mm.
muscle jaw pain here, headaches, and they get to our website and they try to make sense out of what we do. And I was like, is there a doctor nearby that uses this? Because I can't choose since I had a dental treatment. You know,
Mm.
I have that weird feeling, right? Uh, the raspberry feeling, right? The tiny little bit that it's too high or too low that fucks up people completely, right? And
Mm.
that's something we should to avoid at any cost.
I completely. That's a powerful thing, Bjorn. If patients are reaching out to you in pain, wanting to know.
Everybody knows somebody who had a horrible dental experience.
Yeah.
They
Yeah.
go there, they do an impression, they have an appointment 2 weeks later, right? At least think of why does it need 2 weeks to get a night guard? Shouldn't take 2 weeks. You go there,
No.
and then they tell you, the lab said we cannot do a night guard. We have to do another impression. Then you do another impression. Then you go back home. 2 weeks later, you get back in. You get a splint. It doesn't fit. You say, I can't really, it's not comfortable. It hurts. And then the dentist starts grinding for 10 minutes, 20 minutes, 30 minutes. The next patient is waiting. He says, I'm sorry, but take it home. It will get better. If not, come back in 2 weeks. It doesn't get better. They get back in 2 weeks. Horrible. Horrible. And
Yeah.
that's every day, right? That's a big problem.
I agree. I agree with that. John, anything more you want to show us in Bite Finder? Any magic that we haven't covered?
I mean, not only you can just use this for all on X, you can use this for dentures with visible wear. You can use this for just wax up cases, uh, single unit crowns even. And I feel like the scanning for single unit crown dentistry has died, right? We need to be doing full arch scans all the time so we get all of that data for Bite
Full
Finder,
arch every
things
time.
like
Come
that.
on,
Yep,
guys. There's no
full
impression
arch every
material
time.
here. An extra
Yeah,
15 seconds. Let's go around the arch.
Yeah, skip the
exactly.
bite scan. Make a full scan, right?
Yeah.
Better time.
Yeah.
For real.
Any doctor using iOS out there, you should just please scan full arch every time. Every time.
Every time.
Why would we do quadrant dentistry anymore with iOS scanning? I mean, 3Shape has some fantastic monitoring software measuring wear over time. I know a doctor that scans every patient on cleaning. He actually has bruxism records now on all of his patients because he's been scanning them full arch for 5, 6 years. What a powerful thing to show a patient,
Yes.
you know?
It's amazing.
Well, Jonny, this has been super fun. Bjorn, super fun. I can't wait to talk more,
Thank you.
Bjorn, about some of the releases that you have coming out. If you have any big updates, we should do this again.
Absolutely. And if you want to have a look at how like different appliances are being made with BiteFinder, feel free to reach out to us. Reach out to Jonny at Evolve. He's great. He can share a lot of real life cases as well. And just try it
Right.
out. I mean, it's important. We need to work on better dentistry.
I'll drop the show in the show notes on YouTube. I'll put links to your website, Bjorn and Jonny. I'll put you on there. I'll put your cell phone in there so people can call you. Just kidding. I'll put your website in there. But yeah, reach out to Bytefinder or Jonny at Evolve, and they'll take great care of you. Guys, thank you so
Jonny
much.
Exocad on Instagram.
Jonny Exocad, that's right. Jonny Exocad on
Let's go.
Instagram. I love it. I love it. Thanks, you guys. This has been a lot of fun.
Yes.
Thank you. It was so fun.
See ya.
Take care, Rob. See you soon.
Take care, Rob.